Mrs. Jessen came in with a very large mass in the left frontal area of her brain. Throughout that day, she had walked out to the back of the yard. She couldn't really recall what had happened, but she woke up in a big pool of blood. Essentially what had happened was she had fallen, hit the back of her head on the ground, and caused a scalp laceration.
It was traumatic. I was covered in blood. I'd chewed up the inside of my tongue, and I didn't realize it until I went in and looked in the mirror and was like, oh my God. It took me a couple of hours to get up. I was groggy. And then we got to the emergency room.
She was brought to the Methodist Richardson Medical Center in the emergency room where a CT scan was performed, and it showed a very large mass in the left frontal area. It didn't look like the tumor was actually growing from the brain itself, but on the surface of the brain. If you look at the anatomy in that area, the brain is encapsulated in this membrane called the dura, and it looked like the tumor was growing from this dura called the meningioma.
My first meeting with Dr. O was in the emergency room. He was very professional, very matter of fact. You've got an apple-sized tumor in your head. We think it's a meningioma, and we need to get it out within the next couple of weeks.
What was unique about Mrs. Jessen's case was the sheer size of the tumor. It was very large. It was probably one of the biggest, if not the biggest tumor I had ever encountered as far as the meningiomas go. And if you can imagine something like that in somebody's skull, it's a lot of space for the brain to accommodate. The other unique features about Mrs. Jessen's case was that the tumor was so big, it was involving this very large draining vein called the superior sagittal sinus, which runs right in the middle of the brain. So these were some of the challenges that I had faced before considering taking the tumor out.
The morning of my first surgery, I was ready to get it out. I was so ready to get it out, get it over with.
The morning Mary's surgery, you're just ready to move through this thing and go on. We had done all the prep, we had done all the investigating that we needed to. We had made all the decisions, the hard decisions, and then it was just time to turn it over to God.
When somebody comes to have a brain tumor taken out from you, I don't take that lightly. It's a very difficult times for some of our patients and their families to go through. What I like the best about working at Methodist Richardson is we have some of the most state-of-the-art instruments and machines to help our patients with the surgeries that they need. We have this very expensive equipment called the Brain Lab, which was actually purchased with some help from our foundation, that allows us to navigate during the surgery, which means instead of guessing where the tumor is, we're able to use a high-resolution MRI and be able to exactly localize the tumor even before we make first incision. The operating room at Methodist Richardson is one of the most efficient, if not the most efficient operating room that I've ever worked with.
They all know what they're doing, but they're caregivers. They're not just nurses, they're not just doctors, they're caregivers.
This experience has changed my life by giving me a second chance to start over and fix things that were broken. Like my marriage, my body.
To see her go through months and months of recovery, and to see her now giving back to the Methodist system by volunteering at our hospital is such a wonderful thing. Every time I see her at the volunteer desk, it just warms me up.
Knowing that people contribute to my recovery by donating is amazing. I mean, I'm thrilled to, and it makes me want to give financially also. So, not just my time.
I think giving financially means that you're really taking action and you're doing something that helps. Mm-hmm. And although you can't change the tumors, you can't change the spine issues, you can't change cancer, giving to the hospital that addresses that and is on the front line of the war against those things, is something that is very empowering and empowers each and every one of you all to do something today. I remember asking Mary one time, why? And I think, tell them why you're doing it.
Well, they saved my life here. That's why.
Yeah,
So.
pretty cool.